Fibric acid derivatives are fibrates. So their mechanism of action, it decreases the hepatic uptake of free fatty acids, therefore decreasing the triglyceride production or triglyceride levels in the blood. Basically, this is the cholesterol in the blood. So what happens is it activates lipoprotein lipase, an enzyme that breaks down the cholesterol. Part of its mechanism of action is also it inhibits lipolysis of fat. So basically, it suppresses the release of fatty acids from the adipose tissue or the stored fat in our bodies. The therapeutic effects of fibrates is basically to lower triglyceride in our bloodstream, and also it does have some effect on the total cholesterol, but mostly it's primarily for triglyceride lowering. So based on the therapeutic effect, what are the indications for fibrates? Well, the main indication is hypertriglyceridemia or increased triglycerides. So some precautions, we have to be very careful when it comes to administering this medication to patients with renal or hepatic dysfunction, because we know that it does affect the kidneys and the liver. We have to also be very careful when patients are on multiple medications for cholesterol, such as the statins or the HMG-CoA reductase inhibitor. The combination can increase the risk of developing rhabdomyolysis. So contraindications for fibrates, or the reason why we should not administer fibrates, definitely if somebody has severe kidney, liver, or gallbladder disease. Some side effects that we can expect that can happen when it comes to this medication: abdominal discomfort, nausea, vomiting, and headache. So when it comes to nursing actions, knowing the mechanism of action of fibrates and also the purpose of it, the possible side effects, and anything that we're watching for, it is easier to determine what are the nursing actions or nursing interventions. One, we need to follow the lipid panel, right? We want to know what our levels are before and after to make sure that the medication is working the way it's supposed to be. And again, that's definitely including the triglycerides. So that's a very important component of that lipid panel, because primarily the purpose of this medication is to lower triglyceride. And also it does have some effect on coagulation. So it's very important also to check the coagulation test. Examples of these drugs, common one is Lopid or gemfibrozil, and there's also Tricor or fenofibrate. Again, remember the ones with the asterisk, so gemfibrozil.